The first mental hospital is the Cavite Center for Mental Health. The first facility is the ICU building, the Crisis Intervention Unit that provides emergency psychiatric services in a manner that is person centered and strength based as well as timely and efficient. The second one is the Psychological Services Building. This building was contracted to consult with other staff members in planning programs or events to meet the special needs of children as indicated by psychological tests, interview, and behavior evaluations. This building is another example for one of the facilities in the Cavite Center for Mental Health. The next one is the Metro Psych facility in Cebu City. I don't have any much data regarding this mental hospital because first, their website is down and second one is that there is not enough feedback in this mental hospital. But this hospital was considered one of the biggest hospital here in Visayas, but we don't really have enough information that we could use it in order to explain this mental hospital because their website is really down. We don't have any access in the information and there are not enough feedback or comments in the Facebook or any social media platform. The next one is the NCMH or National Center for Mental Health, formerly known as the Insular Psychopathic Hospital, the Mandaluyong Mental Hospital, and the National Mental Hospital, was established on 17 December 1928. It was founded in order to accommodate the increasing number of mental patients and other patients with related nervous system conditions who, in 1925, were being taken care of by two hospitals, namely the San Lazaro Hospital and the City Sanitarium in the Philippines.
The allotted budget is not enough to cover improvement of facilities, mental health programs, and services.
The Department of Health allotted more than 1 billion of the funds of the mental health projects in 2017. It is said that it is the highest in the history of the agency. As stated by Secretary Pauline Obial, their budget for medicine access programs for antipsychotics or mental health drugs is 100 million. DOH also allotted the 1 billion for the upgrade and development of mental health facilities across the country. According to Raymond John Nugget, National Chairman of Youth for Mental Health Culture, these items to be funded are maintenance of other operating expenses of National Mental Health Program, capital outlays of development, psychiatric facilities among selected government hospitals, and formulation or strategic plan for mental health. For the succeeding years, the amount of mental health in DOH budget and the budget of the other agencies and with mandates stated in the law to be based on strategic plan to be crafted by the Philippine Council for Mental Health. Stated in 2007 report of the DOH and WHO that only 5% of the healthcare expenditures by the government are directed to the mental health and 95% goes to the operation, maintenance, and salary of the personnel of mental hospitals. He also said that the sufficiency of mental health professionals depends on the availability of the project.
Basically, funds that are allotted for the mental health care in the Philippines are not sufficient to aid and maintain mental facilities in most mental institutions. Though the mental health bill was currently approved on the Congress, it will take time for a bigger budget that will be allotted to mental health care in the country.
A published article of CNN states that mental hospitals in the Philippines will receive more funding from the government because of the mental health related awareness program that was implemented in the year of 2017.
Issue says all mental health care can be addressed by allocation of funds from the national government. They should have more professionals who can give experts and adequate treatment for the patients, or rather how they can improve the facilities for the conditions of every patients because their environment makes them more suffer, like sleeping on the floor, eating without any nutrients, and also not enough medicines can overwhelm their conditions. They also need to establish some guidelines on how they can assist their patients on their treatments.
Maybe the reason why sick people are negatively stigmatized because hospitals are poorly managed.
Society probably spends more time trying to ignore mental illness than to understand it.
Mentally challenged people are treated as if they are prisoners. Patients shouldn't feel like their dignity is compromised by their illness.
The maintenance of mental hospitals in the Philippines is quite questionable.
The facility sustains all the needs of the patients. Based on what we've read and seen about the mental institution here in the Philippines, it is clear that they cannot sustain all the needs of the patients. Here in the Philippines, it is evident the lack of rooms, lack of equipment, and bad surroundings in most of the mental health institutions. For instance, in CCMH or Cavite Center for Mental Health, they have almost 100 patients in a ward, and they have rooms enough just for their space. So when a person has a flu or other disease, the tendency will be other patients might get affected or infected with their disease. The mental health facilities in the Philippines must be able to provide facilities that have enough room, therapeutic environment, cleanliness, security, and safety. First, for the rooms, they should be able to provide sufficient room for patients that will give them comfort, and also offices and staff rooms for the employees. Next is the therapeutic environment. A good image of surroundings can help and can also affect the mind of the patients. Next is the cleanliness. It is also important to maintain cleanliness in order to avoid different kinds of diseases and to have a more presentable environment for the patients. And lastly is the security and safety, which is one of the most important because patients must be safe at all times, especially in a mental institution, and also for them to feel secured in the place.
But there are facilities that still lack equipment, tools, and even beds and cushions. A mental hospital from Mandaluyong does not have any beds or any blankets, so the patients lie on their back on a hard, cold surface. And the reason behind is that they believe that bed can be used for self-harm and blankets can be knotted together to strangle themselves. There are also mental hospitals that was built like an ordinary house, composed of a tin roof and an unfinished concrete wall.
Politicians are torn whether they should propose law that is rights-based or service-oriented.
On June 21, 2018, Thursday, Senator Riza Hontiveros lauded President Rodrigo Duterte, saying the signing of Republic Act 11036 would set the path for the government policy in integrating mental health care in the country's public health care.
Issues on mental health care can be addressed by allocation of funds from the national government. They should have more professionals who can give experts and adequate treatment for the patients, or rather how they can improve the facilities for the conditions of every patients because their environment makes them more suffer, like sleeping on the floor, eating without any nutrients, and also not enough medicines can overwhelm their conditions. They also need to establish some guidelines on how they can assist their patients on their treatments.
The more money you have, the better care you will receive, regardless of the severity of your illness. People who pay receive quality treatment, while those who can't would have to deal with long lines in public mental hospitals with somehow below average level of treatment.
Mental health care providers continue to receive smaller budget increases than hospitals. That mental health care patients are receiving poorer quality care because of the widening gap in income.
We therefore conclude that the facilities of our mental institutions cannot sustain all the needs of the patients, and also it cannot accommodate the number of patients in a certain mental institution. It is evident that there are lack of rooms or psychiatric wards, especially in the National Center for Mental Health in Mandaluyong City. We, as LaSallian students, should promote the importance of mental health. We can start with our family members, friends, and relatives by checking them from time to time and assure them that we are ready to listen if they have problems. Also, we can use our social media accounts to inform the people and to raise awareness. As per the facilities, we should start a campaign regarding the improvement of the facilities of the mental institutions so the government will be notified about the issue. In addition, we have noticed that the more money you have, the better care you'll receive.